Hello, my name is Annalie Martin, and we had the option to do a discussion or a paper for the first part of our skills, and I decided to do a discussion. I just have in front of me some notes that I came up with that I felt was important from our textbook and our PowerPoints and my own research, just so that I can contribute to the discussion, and I will be reading that to you today. So we're going to be talking about the preoperative checklist, preoperative teaching, and pertinent labs. So the preoperative checklist is very important for making sure that the nurse can remember to complete everything that is necessary before the patient goes into surgery. Surgery is a very important time, and it can be very crucial that you do everything to keep the patient safe and stay in there, for the patient's best interest. So this kind of helps the nurse to follow hospital policies to keep the patient safe. And it's an organized way to assure their quality care. Vital signs before the surgery can help to get a baseline. These baseline vitals are very, very important, and they're used to compare to the vitals during and after surgery to monitor complications with surgery. So, for example, sorry, it's my Roomba. So anticoagulants, that's what, like, certain medications you're definitely going to want to look out for and make sure, if the patient is taking them, that the physician is aware, and that, also that you're aware, so that you can take the necessary precautions, because anticoagulants can change the normal clotting factor. Antihypertensives and anesthesia taken together can cause bradycardia and hypertension. Antiarrhythmics can cause lessened heart contraction. Anticonvulsants can change metabolism. Corticosteroids affect the adrenal glands. With insulin, the dosage may need to be reduced for the surgery. Diuretics may result in fluid and electrolyte imbalances. And antihypertensives enhance the action of anesthesia. So medications such as diazepam, so please excuse my pronunciation with these, but midazolam and lorazepam are given before surgery to reduce anxiety symptoms and to decrease memorization of events during the surgery. Anticholinergics like atropine and glycopyrrolate are given to lessen pulmonary and oral secretions. They also inhibit laryngospasms. So the neuroleptanologesics agents such as fentanyl, citrate, droperidol are given to cause a general state of calm and sleepiness. Histamine 2 receptor blockers such as cimetidine and ranitidine are given to decrease gastric acidity and volume. Narcotic analgesics such as morphine are given to facilitate patient sedation and relaxation and to decrease the amount of anesthetic agent given. The information contained in the informed consent includes a description of the procedure or treatment, any alternative therapies, and the option for non-treatment, the underlying disease process and its natural course, the name and qualification of the health care provider performing the procedure or treatment, and the explanation of the risks and benefits, and the explanation that the patient has the right to refuse the treatment and consent can be withdrawn, and the explanation of the expected, not the guaranteed, outcome of recovery and rehabilitation course. So that is a very, very important document to make sure that is signed. So usual pre-surgical screening tests will include a chest x-ray. This could show pertinent medical problems that could affect surgery. An electrocardiograph, this helps determine if you are at risk for a heart attack or heart failure. So this is something that may need to be, if it is abnormal, additional cardiac clearance may be needed. Then we have the complete blood count. This checks for anemia and infection, which would be shown by an elevated white blood count. The decreased hematocrit and hemoglobin level could indicate a presence of bleeding anemia and elevated blood urea nitrogen. Electrolyte levels, hyperkalemia or hypokalemia could give you an increased risk for cardiac problems. A urinalysis shows potential kidney issues, and glucose testing is done as part of pre-surgical screening and often repeated the morning of surgery. Preparing the patient psychologically through teaching. Teaching a patient is and also of course their families about surgical events, certain sensations, and how to manage their pain. Also, the activities after preoperative care, like physical therapy or range of motion exercises, is very important. The timing of the teaching is also very critical, because they may need to, they may forget it, depending on when you teach them, how you teach them. Like, I know the same day surgery, one thing I learned through my reading is that you want to give that teaching, written teaching, that it has been proven to be best for same day surgery. In my mind, I was just always thinking that, like, the having them display it back to you would be best, but in this case, that was something that I learned, is that in this special case, that's not the best, and that you would want to give them written teaching. So you also are going to want to teach them about the type of surgery, and you also want to, determine the best teaching for them. So it is very important, preoperative teaching, to decrease complications. Many institutions provide teaching sessions before admission to prepare the patient for surgery. Whenever it's done, just make sure, of course, that you do that preoperative teaching checklist, because that, if where you are offers it, because that can be very helpful. So certain types of teachings that may be given in the preoperative phase, obviously this can be different depending on what type of surgery. Like in the video we were watching, the woman was having surgery on her wrist. So in that case, you would, do more patient-specific teaching. And I also saw some patients after surgery how to use the incentive spirometer, so that would be a teaching specific to that. So you're going to want to teach them about if they have exercises and physical activities. Deep breathing exercises is very common. Coughing, turning, the importance of turning them. They might be like, why are you moving me? I just got done surgery, and you will most likely need to teach them that. So like leg exercises, the importance of early mobility. Again, they may be like, I just had surgery, leave me alone. And you are gonna, you'll want to teach the patient and educate them why that's so important. You'll want to educate them on like pain medication, the meaning of the PRN orders for their pain. You will want to teach them the importance of timing, splinting the incision. We had a great video of the patient. She gave him a pillow, and every time she would have a move, he would hold the splinting pillow. That was very great teaching on her part. And also, you're going to want to educate them on maybe the visit by the anesthesiologist, why they're MPO, medications that they may need the night before or after surgery, and you want to educate their patients, show them where the waiting room is, and also, when you're transporting them to the patient by the stretcher, you might want to prepare them for that. So this video was a little bit longer than I liked. I tried to talk fast. I hope it wasn't too long, but I hope that this was an acceptable understanding of all the requirements for the 3 things that we needed to include in this discussion. Thank you very much.